This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today I'm going to talk about how to get rid of chronic thumb pain. So first off, it depends on where your thumb hurts. When it comes to thumb pain, there's three main diagnoses of things that bother people. Of course, there's a lot of other diagnoses, but this covers the great majority. One is trigger finger, meaning that your thumb, your tendons go through pulleys, and right at this pulley at your thumb, it hurts. And with someone who has this, it'll hurt right when you press here, their finger may get stuck, and that can present with all strange sorts of pain. So if you have trigger finger, the easiest thing to do is just kind of stretch it back like this to get that tendon actually moving. That's what I would start with. If that doesn't work, then you may want to see a doc, and what they can do is they'll end up injecting that pulley and tendon right there, and that can actually be curative in 70% of cases and take care of the pain completely. That usually works pretty well. If you try 2 shots there and it's not really working, then some people will do surgery where they'll make a small incision and cut that pulley. But for the most part, I would just try stretching, and if it doesn't get better, I would see someone. So that's for pain kind of right here, but trigger finger pain can be weird in the sense that it can travel all around the finger. So sometimes you get some non-typical examples of trigger finger causing thumb pain. A second example is when you get pain in the base of your thumb, kind of right here, really also at the base of your hand on the thumb side. And what that is usually is something called the carpal metacarpal arthritis, or arthritis of the metacarpal and the trapezial joint. This is something you normally see in females aged around 5th, 6th decade of life. What ends up happening in females is their thumb's a little bit more flexible, and they end up just getting a lot of pain right at this point there, which is really due to arthritis. So for that's a tougher one to treat. First line of treatment is you can get something called a Cmc Wrap, which stands for carpal metacarpal, which wraps around here and that helps with activities. Like any arthritic joint, sometimes I'll give it a steroid injection, and sometimes people can do really well from that for a long period of time. The only true fix of that is a surgery where they actually remove that bone and take one of your tendons and put it in there like a little sardine, which I know sounds kind of disturbing and funny at the same time. But again, that's only if everything else fails. But pain at the base of your thumb, that's usually what it is. An x-ray will tell you for sure, but I would start with that Cmc Wrap just around your hand and see if that makes a difference. Now, the third reason people can get pain at their thumb, it's kind of actually more the wrist, is they'll get pain right here, and that's from a couple tendons that go up to the thumb, and it's called de Quervain's tendonitis, or tenosynovitis if you want to be fancy. And that can be cured by just stretching a lot. And by stretching and some splint usage, that can help. There's some therapy exercises that can help as well. Sometimes we'll try injecting it, that can help as well. And then rarely, if all that fails, there's a surgery where you release the dorsal or the back part of that tendon sheet. But for the most part, just some simple stretching. And if that doesn't work, a steroid shot usually can clear that up completely. So those are most of the things that cause thumb pain. Of course, if you break it, people can tear other ligaments and things. But the 3 things that I mentioned, the trigger finger, Cmc arthritis, and de Quervain's tendonitis, which I guess could be more radial wrist pain, cover most of the pain in that area. So I hope I was able to answer your questions about how to get rid of chronic thumb pain. If you have any questions I didn't answer, feel free to leave them in the comments below, and I'll do my best to respond. But note that I can't give you specific medical advice about your specific condition. If you like this video, we put out new content weekly, so please like and subscribe, and thanks for watching.